Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to share a kind of an experience that I had today. One of the, I don't know if it's a frustration. I guess it's a frustration that I have. I had a patient come in, and I've been seeing him. He comes from a long way, and it's liked me, and so I've done shockwave on the bottom of his foot. He had problems with ingrown toenails, and today I did a matrixectomy on him. But what kind of, I don't know, I kind of admired them, but then I got a little frustrated. So there's this group that's called Gait Happens, and they are some physical therapists from Colorado. And so whenever something kind of, I don't know, inspires me or annoys me, I think of how that can be copied, right? So what they have, there is a local physical therapist that they are part of, local physical therapist, and they referred over to this other physical therapy place in Colorado called Gait Happens. And I kind of admire them because they did this. And so this patient, I've watched him walk, and I guess he was having some foot pain, and he had their gait evaluation. I guess they had so I think the local physical therapist took pictures and sent them over for a virtual consultation with this Gait Happens. So, and then the patient basically paid, I think, $200 or $250 for the initial consultation. And I don't know if they can work in Massachusetts, so they must be doing more of like a coaching model and saying, because I read the paperwork, they said this is not considered medical care. And then they did 2 other follow-ups, and I think they were $90. So I don't know how it worked out, but I'm just kind of throwing out some ideas here, because is there a way that if you you have a real specialty in something, you could work in conjunction with a podiatrist to refer them to you? So, for example, I know with Correcto's Ray, he does these consultations, and so I could refer to him, and I don't know if there's a way they do a fee splitting type of a thing like that, so that he would get more business or his other associates would get more business, and then you would also get some more business with that. So just kind of a way of thinking outside of the box of keeping it within the profession. So, for example, Gait, I wouldn't refer to a physical therapist, but certainly if I knew a podiatrist like Ray that really likes Gait and he wants to do virtual things, I could send it over to him. Or if there was a person that does nutritional work, I would be incentivized to do it if there is some type of payment for that. For example, as I'm working with these shoe places, I did finally find a shoe that had an affiliate program with LEMS, which I already sell in my office. Now, if I sell at my office, I get about 50%, but not everyone buys. And so with this online thing, I get 10%. So 10% is better than no percent. And I'm sending patients these anyway. So is there a way that we could do this within our profession for certain people that are really good at things that maybe we're not as good at, or they have a really good process of doing things that we don't have a great process for? That could be dermatology, it could be sports medicine, it could be other things like that, and people are willing to pay more, or they're willing to pay out of pocket for that. So I'm just going to kind of throw an example. One of the docs I have in my office is Dr. Feldman. He does a lot of ultra marathons and tries and all these other things. So theoretically, he would be happier if he only saw those things. He would be happier if he only made cash, right? As we all would. So one thought is if you or if I had a patient that had needed to see a triathlete or a doctor, they would prefer seeing other triathletes. So I could refer them to him. I'm in the same practice. He gets that through the insurance. But if they were in another state and they couldn't accept the insurance because we're out of state, that could be done as a coaching call. And kind of like this person that got this gait evaluation and a couple evaluations and a couple of doing some strengthening exercises and giving some recommendations and a couple of follow-ups, that might be a good thing. I'm not sure if that's the largest check, but I think that's kind of a neat way of doing it. So what are you really good at doing that others could send their patients to you, and then potentially you could do a profit splitting type of a thing? And this could be within podiatry, but this could also be within, for example, nutrition or help people lose weight, or other types of things like that? What are these things that would really give benefit to patients to do? So anyway, that's just the kind of the thought that was on my mind today. I could have done this gait exam, right? But I don't have a really cool process for it like they do. And I don't have a really good examples of how they can strengthen their intrinsic muscles and all these other exercises that these physical therapists could do. But I think that's something that easily I could develop. I don't think this is really my largest check, meaning I don't think this is the thing that would bring in a lot of revenue, but I think there are some other things that could be done for that. So anyway, if you want to look at their site, it's called Gait Happens. It's kind of a neat site. You can look at how they developed actually a membership site as well. I'm always envious, and I'm still figuring out how to do that with Podiatry Practice Mastery, and even with my Dr. Pelto. So if I could, I could figure out a specific niche that I could offer to patients. I've thought about diabetes. I'm not really that passionate about it, but I thought about like doing a diabetes thing where they get something every month, and they would pay every month, and you would give them shoe recommendations. If any of you guys are interested in doing a collaboration and you're really inspired about diabetes, I'd be happy to set you up for that. Let me know, because basically my whole thought is we would develop a drip course, basically every week or every month. Like, let's say every month they would get a something special, and every week they'd get a newsletter, kind of like I'm doing, and then they would pay, let's say, I don't know, $20 a month, and then we could put it on this Kajabi thing that I already have going, and then you could do a profit sharing. Basically, this could be offered to other podiatrists. Have this non-doctor have not my name on it or your name on it or whoever's name on it, but then the doctor would refer their patients to it. The patients would pay $20. Let's say the doctor got half of that, which is usually during affiliate type of online information things, it's 50-50. So the doctor, every patient they would refer over, they would get $10 forever until they stop. So that would be a win-win for the doctor. And it is, I don't think that would fall under antitrust, because it's not, I don't think it would. I have to, if it does, let me know. But I was thinking diabetes would be a good idea. I'm just not that passionate about diabetes. But if you ask me about something else, I might be more passionate, like this whole practice management. So if you look on their site, they have stuff on just for regular patients on Gait, but then they also have for practitioners. So for Gait, for regular people, it's $20 or $25 a month. And then for practitioners, it's $50 a month, which I think is kind of neat. And I think that's going to be kind of my model, is giving it to the doctors once we get to that 300 mark, having it like $50 or $100 a month. And then if you want to actually ask all the questions you want and get those answered, that could be $150 or something like that. So kind of those are the ideas. Sorry, I kind of rambled a lot, but if you followed with me, you followed the whole time. If you didn't, you ended before this time. Okay, great. Thanks, guys.